we've been lucky in multiple myeloma to have many agents that really work for our patients. And a novel class of agents has been BCMA-targeted therapies, including CAR-T, cell therapy, and bispecific antibodies. And so now what we're trying to figure out is how do we sequence all these therapies that we have, how to optimize the response, and how to sequence them. And so we looked at close to 200 patients across the nation who received Teclistamab, which is a BCMA-directed bispecific antibody. And these patients who got Teclistamab had received prior BCMA therapy, either CAR-T cell therapy, antibody-drug conjugates, or different bispecific antibodies. And so we looked at how these patients responded to Teclistamab after having had prior BCMA-targeted therapy. What we found was the patients actually had lower response rates to Teclistamab after prior BCMA-targeted therapy. So 51% versus 61% for patients who were BCMA naive, so no BCMA-targeted therapy at all. And the patients did show a trend towards worsening actually of PFS. So patients who received prior BCMA-targeted therapy and then got Teclistamab, their progression-free survival was shorter actually. Another thing that we found was that if you actually wait more than 9 months from prior BCMA-targeted therapy and then you give Teclistamab 9 months after that, that actually can help your patients respond better. And so the optimal time cutoff for patients, if you're thinking about sequencing BCMA-targeted therapies, waiting 9 months actually would probably help get better responses and potentially better progression-free survival for patients with Teclistamab.